Welcome friends to my series on diabetes. Diabetes, what every lab professional must know. I am Dr. Arun Kumar Harit. Diabetes is a very big problem in India, and India has turned out to become the global capital of diabetes. Every lab in India is doing some or the other test which pertains to either diagnosing or monitoring a case of diabetes. So it becomes essential that we working the lab should know everything about diabetes, the ins and the outs of diabetes. This series is going to address that issue. In the present lecture, we'll be talking about the definition of diabetes. Subsequently, I'll talk about the metabolic alterations that occur in the diabetes, what exactly is happening inside the body that is causing diabetes and the complications of diabetes. Then we'll discuss about how to approach a patient for diabetes. That is, when a person comes to us, what is the initial investigation we'll do to either diagnose or confirm diabetes. We'll talk about special cases of diabetes, which is called LADA, MODY, GDM. Each of them is going to be an independent, in-depth concept. We'll discuss glucose estimation, GGT, and interpretation of the results. We'll talk about glycated hemoglobin, HbA1c, how it is estimated and what is the clinical significance of it, and how do you interpret when there is hemoglobinopathies. We'll discuss about microalbuminuria and diabetic nephropathy. We'll talk about albumin creatinine ratio, new special tests like the fructosamine, 5-anhydrous glucitol, C-peptides, insulin antibodies. So there are a lot of things that we need to know about diabetes, and in short videos, I'll be addressing all these issues. So the first question is, what is diabetes? We all know that diabetes means increased blood glucose levels or hyperglycemia. But then what is hyperglycemia? The American Diabetic Association has done extensive work on raised blood glucose and have given some criteria which the world universally follows, and this is what we are going to discuss today. If a patient's HbA1c or glycated hemoglobin is greater than 6.5, the person is called a diabetic. Or if a patient has a random blood glucose level greater than 200 milligrams per deciliter in the presence of osmotic symptoms. Now, what do we mean by osmotic symptoms? When the blood glucose level increases, the glucose is excreted in the urine. When it passes in the urine, it exerts what's called the osmotic pressure and pulls a lot of water, as a result of which the patient passes a lot of urine, polyuria. It becomes more manifest in the night, so it's called nocturia. That is, increased volume of urine, increased frequency of urine in the night. And because the person is passing a lot of urine, he's going to feel thirsty. He's getting dehydrated, so he'll feel thirsty. So a combination of polyuria, nocturia, and thirst together is called the osmotic symptoms. So if a random glucose is more than 200 milligram per deciliter and the patient has an osmotic symptom, then also the person is diabetic. There are two more criteria. That is, if a fasting glucose, fasting defined as 8 hours of fasting glucose greater than or equal to 126 milligram per deciliter, or a 2 HPG, 2 hours post glucose. That is, you give 75 grams of anhydrous glucose and 2 hours later you take a blood sample and estimate it. If that value is more than 200 milligram per deciliter, there's a high probability that a patient is diabetic. We need to repeat this test again within 2 weeks, and if again we find either of the values high, it doesn't mean that we have to do both of them. Either the fasting or the 2 HPG, if they are for 2 consecutive readings more than the cutoff value. What's the cutoff value? Fasting greater than or equal to 126 milligram per deciliter, 2 HPG, 2 hours post glucose greater than 200 milligram per deciliter, then the person is called a diabetic. Now remember one important thing. When we're talking about 75 grams of glucose, it is 75 grams of anhydrous glucose what we get lab quality. What we give our patients is Glucon-D or whatever you get from the pharmaceutical shops that contains the water of hydration. So there we should be giving 82.5 grams of glucose. I'll touch upon this when we talk about the GTT. Diabetes, we all know the type 1 and the type 2 diabetes, which is the most common thing. But now the other important variants of it is LADA, latent autoimmune diabetes of adult, and MODY, that is maturity onset diabetes in the young. There is a separate condition called GDM or gestational diabetes mellitus. So we will understand all these. Type 1 diabetes is when there is a decreased production of insulin. That is, the body starts to destroy the pancreas either with antibodies or because of any blood supply issue to the pancreas, where the pancreas get destroyed. As a result, the body is not able to produce insulin. Then the patient is having type 1 diabetes and needs to be provided insulin to ensure that the blood sugar is controlled. This is type 1 diabetes is usually seen in the young age group, less than 20 years of age. Type 2 diabetes is characterized by what is called insulin resistance. The pancreas are producing insulin. In fact, the pancreas are producing more insulin than normal, but the insulin produced is not able to take care of the amount of glucose present in the system. So this is called type 2 diabetes, characterized by insulin resistance. The requirement of insulin by the body has increased. Most of the patients we get are the type 2 diabetes. MODY is maturity onset diabetes in the young. Now what I said was that when there are antibodies that destroy the pancreas and produce diabetes, the type 1 diabetes is usually seen in young. But there is a certain group of young children, less than 20 years of age, who have diabetes but have good insulin production. This category is called MODY. That is, they are children less than 20 years of age. They have high blood glucose level as defined by the ADA, but the insulin production is good. This group constitutes MODY. The other group is latent autoimmune diabetes of the adult. Now I said that in type 2 diabetes, which is generally seen in the adult, there is insulin production, but the body requires more insulin. So the word we used was insulin resistance. LADA is seen in people over 35 to 40 years of age. This has an autoimmune background, that is, the bodies are producing antibodies to destroy the pancreas. These people will eventually require insulin for treatment because the body is not producing insulin. Now, we said type 1 occurs in young, where the pancreas are destroyed and insulin should be supplied. LADA is something like a type 1 diabetes seen in the adults. So this is something that we should know. There's going to be a separate video detailed explaining all this. The last is the gestational diabetes. Now in pregnancy, the mother has to provide nutrition to the developing child, as a result of which the blood glucose level of the mother is usually high. But when the blood glucose of the mother increases to a greater level, there are specific definitions for that, which we'll discuss when we talk about gestational diabetes. When the blood glucose level increases beyond that, then the lady is said to be having gestational diabetes. It is important to note that before the pregnancy, the lady was not diabetic. During pregnancy, she becomes diabetic. And after the child is born, she becomes back to normal. This is a diabetes during the phase of pregnancy. It has complications for the mother, it has complications for the child. So the diagnosis of this condition and the management of this condition becomes essential. So effectively, what we understood in today's lecture was, we defined diabetes. Diabetes was defined by the American Diabetic Association with 4 criteria. HbA1c value greater than 6.5%, or a random glucose greater than 200 mg per deciliter in the presence of osmotic symptoms. Osmotic symptoms we said was increased urination in the night, or presence of increased thirst. All these together is called the osmotic symptoms. So if a patient has osmotic symptoms and you do a random blood glucose which is more than 200, we call them diabetic. These don't need to be repeated. Or a fasting glucose greater than or equal to 126 mg per deciliter, or a 2-HPG, 2 hours post glucose, 75 grams of anhydrous glucose, 82.5 grams of commercial glucose. If after giving this amount of glucose, after 2 hours, you find that the blood glucose level is greater than or equal to 200 mg per deciliter, these patients are also called diabetic. For the fasting and the 2-HPG criteria, we need to repeat it within 2 weeks time. We talked about type 1 diabetes where there is decreased insulin production seen in the young. We talked about type 2 diabetes characterized by insulin resistance. The body is producing insulin, but the body requires more insulin to take care of the glucose. This is usually seen in elderly age group between the 40 years plus. That's type 2 diabetes. Most of our patients are type 2 diabetes. We have a condition called MODY, maturity onset diabetes in the young. This is seen in children less than 20 years of age, but the difference between type 1 and MODY is that in MODY the insulin production is normal, whereas in type 1 the insulin production doesn't occur. Then we have LADA, latent autoimmune diabetes of the adult. This is seen in the adults. Here antibodies to the pancreas cells destroying the pancreas cells are detected.